Welcome to another episode of Delay the Decay. Today my guest is Dr. Corbett Boone. Corbett has spent his life at the intersection of athletics, medicine, faith, and performance. A former Hardin-Simmons football captain and three-time conference champion, Corbett became a board-certified family and sports medicine physician, spending 15 years as a team physician for Baylor Athletics while building a respected non-surgical orthopedic practice. He's also a proud husband and father of three. Now, after years of treating injuries and caring for athletes, Corbett is asking broader questions about prevention, metabolic health, and what it takes to actually thrive. That journey led him to launch 619 Health and Wellness, focusing on functional health, longevity, and helping people pursue better health before disease takes hold. Corbett, welcome to Delay the Decay.
Thank you, Dan. Blessed to be here. Thank you.
Absolutely. This is going to be a lot of fun. I'm grateful that our mutual friend Joby introduced us. I'm excited for what you've got going on down there, and grateful for the reputation that you have, and that you apparently are a man that doesn't just rest on his laurels, but you are a man of conviction. You're a man of humility that we're going to talk about in a few minutes. And you're a man that really wants to come alongside people and help them thrive. So just grateful for that. One question that we always start off with here on Delay the Decay is, what's one habit or discipline that you have been incorporating into your life recently to help you move upwards and to the right?
Well, I've done this many times before, but recently have gotten back into it, and that is simply getting up every day at the same time and going and walking. Just getting up and moving, getting sun and getting the Lord's creation in my eyes first thing makes me aware of who I am and where I am, and that's a very small person on a very big earth. And to be honest with you, with that list of things, that you put after that, the last one is finances, and when those other things are taken care of, the finance stuff is going to come, and so getting out and walking, that takes care of so many things, from the physical to the mental, and especially the spiritual. That's one of the things that I try to do is, you know I'm either praying, I'm singing praise and worship stuff, or I'm listening to podcasts, but mainly focused on my religious faith.
Yeah. Well, you are, as we talked before we went live, you're a busy guy. It's right now it's go time in Texas football, and that is
Yes, sir.
impacts your life in good ways, but it makes things busier. And you said that you get up at the same time every day. You were very intentional to say that. Why is that important to you?
Well, I mean, even one of the basic, pillars of what we deal with is sleep. And people always think, well, how, sleep is important. We all know sleep is important. But they think it's, a lot of folks believe just as long as I get this amount, the old, what did they tell us when we were younger, the magic 8 hours. And, really, if it could be anywhere from, 6 hours to 10 hours, as long as it has a good quality. Because if you don't have good quality, you're getting some rest, but not a lot of the true healing rest that we need. And part of that, starts with really centering and getting your circadian rhythm in proper alignment, which takes care of a lot of things. And so something very, very simple that we try to, teach and preach is do your best, if at all possible, to get to sleep and get up at the same time every day. And that's where I get a lot of people, because a lot of that, they look at me like even Saturdays and Sundays, and I'm like, yep. And this is coming from somebody that has always been more of a night owl. I really started putting this more into my life, even probably just 3 or 4 or 5 years ago, and it has made a huge difference.
Yeah. Yeah, the circadian rhythm is so interesting, and it's something that I've been learning more about as well. I just had a sleep expert on the last episode. Her name is Dr. Melissa Melinek, and she was talking about this concept of the most important thing you could do is wake up at the same time every morning. And And to have you repeat that, it was so encouraging. And to know that one of the principles that she talked about, Corbett, that, I'm preaching to the choir to you, but just for the audience, is that, you start with getting up at the same time every day. And the goal isn't necessarily to get 8 hours sleep, but to get quality sleep, and then start going to bed at the same time as well. And so you have built a very successful sports medicine practice. You've served athletes for years now. And then you decided, because your life is so boring, you've got nothing going on, you decided to start something new. What compelled you to add that to your already busy life?
The easy answer, but I'm not going to leave it at that. Is just kind of a calling, a calling to do more. That stirring that you see a chance to help. And the only reason why you're really not doing it is because it's going to be a possible, hindrance to your current life, or more time away, or time that you have to divert from other things. Honestly, it was just years. It was just years and years, and especially the last few years since COVID, of seeing patients that either need help. Well, it's the combination of the patients that need help, but the patients that really started doing some really cool things to help themselves. What people, ever since 2020, there's people that are way more curious about their health, and about waking up when they saw loved ones get sick or get hurt, and they realize that maybe the way that this is the patients that made changes are like, I saw this and I realized that I'm setting myself up for a potential failure if I get sick. And so they really dove in, and you saw some people make some amazing changes. And when you live in that world also, where I don't just do sports medicine, I do a lot of non-operative orthopedic care and arthritis care, and seeing people that have had to make some big changes just to be able to get their knee replacements. Like, they'll keep seeing me for conservative care, and the joint replacement specialists, they want that BMI under 40. Like, for a lot of folks now, that is just, we don't touch until it gets to that point. And when you dangle that carrot in front of people who are just wanting to be pain free, they'll do it. And then you see them wake up when they get to that point, and they're like, I'm so happy that I did this. I didn't think that I could do it. And then they talk about how much better they feel, and how much the changes in that life let them start shedding, at least parts of their diabetes medication and their blood pressure medication and that sort of thing. And I'm telling you, a lot of it had to do with my patients inspiring me, and then seeing so many of them that needed that help. And if we could have gotten to some of these things before it started, I mean, it's a whole different lifestyle.
Yeah, yeah, that's interesting. Yeah, the traditional medicine is, we've talked about this and we'll talk more about it. It's oftentimes we can throw the baby out with the bathwater. It's traditional medicine isn't bad. We need orthopedics. My wife has had one knee replacement already. She will have another knee replacement. And as much as I hate to see her recovering in that pain, it is really a miraculous surgery that she can then live the rest of her life without knee pain. But that's not the end of it. I mean, she's in the gym 5 times a week. She's watching what she eats so that inflammation doesn't take over her body. And so it's the end isn't orthopedics or supplements,
Yeah,
or medication. Praise God for all those things.
that's right.
But really, there's so many natural remedies that we're going to talk about that really can help people get healthy. Just a quick story: just a friend of mine from the gym that, just a shout out to him. He needed to have his hip replaced, but the doctor wasn't going to do the surgery until he lost 150 pounds, because he was very overweight. And I'm so proud of this friend, because he lost the weight so that he could do the hip surgery. And now He can walk. He can exercise. He's more joyful. He's happier. Well, talk to me just for a minute. This is a little bit of a side, but BMI. They want to see it under 40 BMI. Is that even a good marker to determine if somebody's healthy or not these days?
As somebody now, granted, I still have some weight to lose myself, and during different parts of my life, I've had way too much weight on. I've always disliked the BMI because I've always just been a kind of a muscled up guy, and so it's just always been, ever since I was a young guy, it's been a totally skewed number for me. And if anybody was ever basing anything in my health care over that, I would be toast. And there's a lot of people out there that are like that. I mean, you can see people when you walk in the room and they look good. They've got muscle tone in their, I mean, they got good muscle tone in their 50s, 60s, or 70s. And, you're looking at that number, but, I have great partners that they're able to look at that and understand that.
That's great.
That's really not what we're talking about. We're not talking about we're not talking about the few, men and women that have got great muscle tone that are kind of creeping up to that upper 30s. We're talking about people that are significantly obese and need to get the weight off.
Yeah. Health and Wellness 6:19. It comes from 1 Corinthians. Talk to me about that. Why was that important to you to name this practice after that?
Well, it's always been one of my guiding, my guides to me taking care of myself, because there's some times where I'm worried about my patients, I'm worried about my athletes, I'm worried about my family, I'm worried about my wife and taking care of them. And like many, I would say many people, not just many men, but many people tend to leave themselves on the back burner. And when you really look for that inspiration, I don't have to look for any inspiration past my Creator. And our bodies are temples of the Holy Spirit, and that is not ours. This is on loan. And if you can really believe that and really understand that, it gives you a whole lot more. It puts you in a lot better position to drive and strive to take care of yourself a little bit better.
Mm-hmm. Yeah. For those that aren't familiar with it, verse 19, chapter 6 says, "Do you not know that your body is a temple of the Holy Spirit within you, whom you have from God?" And then it finishes, "You are not your own."
Amen.
You are not your own. And awesome. This life, today's my birthday.
Happy birthday.
I'm 69 years old. And the theme of my journal this morning was stewardship. Just thanking the Lord for the relationships and my body and my mind and finances, and the reminder that I own none of it. That God has, if the Creator of the universe has given us everything that we possess, then we are stewards. That means that we take care of it. And I can't think of a better name for a health and wellness studio, functional fitness practice than 619. You're going to have so many great conversations. It's like having a tattoo. People ask, like, well, what does that mean? So I'm excited about that for you. You said that this journey towards 619 health and wellness, that it required humility. And I think what you were talking about is that you've been classically trained in medicine. You've had a certain path, a good path that you've been on. But it takes humility to think outside the box and maybe question some of the things that you had learned, that maybe there are some new pathways, some new methods. Talk to me about that journey.
I'll go ahead and tell you the story. It's actually a really good story. So, after 2020, I'm kind of like everybody else. I'm like, how can I take better care of myself? I mean, I'm at that point. I was, what was that, 6 years ago? So, I was 42 and in fairly good shape, holding a little bit too much weight, but otherwise still working out, hitting the weight room and having fun with my family. But man, it's just, you kind of start feeling like something was missing, and I'm starting to get into those years where I really need to start doing a better job of stewarding my body better. I'm going to try not to drop names, but there was a physician out of Austin that was doing a lot of this type of stuff, a little bit of health and wellness, and a little bit of the kind of the carnivore diet type stuff. And essentially I was kind of listening and got involved in a lot of that, because it was, how can you get healthier? And then he starts talking about naturally, increasing your testosterone production, getting your hormones in better alignment, less, like you were saying, watching that diet to where the inflammation is a lot lower. And so I'm like, man, I'm kind of dialed in, and he can get really nerdy with the biochem, and I can follow that. My wife used to love listening to him, but she's like, hey, once he hits that part, I get kind of lost. But anyways, listening to him, and at the same time, a friend of mine brought this group also out of Austin to me. To that, he's like, man, you got to check this out for your son. And it was another one of my partner's sons, or in the same grade. And they were kind of in those years of high school where they're trying to, put some size on and kind of get ready for football and other sports. Well, we got involved with that group, and, they kind of had a social media platform that all the guys could bounce questions off each other, and they would let the parents be on there just to oversee and everything. So I'm sitting there sitting at, I'm kind of reading through the text, and I'm like, man, they're talking about a lot of the same stuff. And the before and after pictures of these kids were just amazing. And then, the friend here in Waco that told me about it, his son's before and after pics were just absolutely incredible, because I've known that kid since he was in junior high. I mean, transformed his body. So I get on the phone with that coach. This is the embarrassing part. So I'm getting to that. I talked to that coach, and I'm like, oh, you must know Dr. So-and-so, because, he's in there in Austin. He goes, who the heck is that? And so he had no idea who he was. And so this is the stuff about this, this MD that knew nothing about some of these tenets of health and wellness. Well, they were talking about the same thing. And I just sat there and I looked, and I'm just like, man, these guys, this guy with the kids thing, man, he figured out how to get these kids healthier, and therefore starting to produce more of their natural testosterone, and it succeeded. I mean, with no supplements, no anything. Well, that just tells you what the problem, part of the huge problem of what we're doing is that this younger generation of, especially young men, man, they're doing all the same stuff that you and I did in our late 20s and early 30s, just to wear ourselves out, burn the candle at both ends. Where we were doing that for a job, they're doing a lot of that because of screens, and people aren't putting any emphasis on sleep and getting to sleep, at a decent hour. People staying up and they're running ragged and they're eating crap. And all of a sudden we're seeing teenagers and people in their 20s with testosterone levels lower than they've been and it's probably since they started measuring it.
That's amazing. Yeah. That's a great story. Who is, drop a couple names of more well-known people. Are there some podcasts of doctors in this space or people in this space that you have learned from and enjoy?
Well, the one I was talking about was Paul Saladino.
Okay.
I think he's a great guy. I like how he's where I come in with 619 in trying to help people. And probably some social media stuff that I'll be doing is I want to do the beginner stuff. You know what I mean? Like, I really want people, because I was a beginner just years ago, and I've been so enmeshed in it now for the past 4 or 5 years that I'll get that little guy, talking over here, making me not want to do it, going, well, everybody knows that. But if you look back, I'm like 4 or 5 years ago, I didn't know that. And I'm a sports medicine physician that loves this stuff, and I didn't know a lot of this stuff. So where I'll come in on more the introductory scale, Paul is here and very, very interesting to learn from it. He is he takes a lot of the higher steps, a lot of the things that you can really dial in on and do some really cool things when you've got the basics taken care of. But you were asking about somebody else, and there was an awesome interview with Peter. Was it Peter Attia? I always say it wrong. I finally been listening more to his podcast and listening to him say it. But he was doing an interview on 60 Minutes where they were kind of doing a fast, hit, what's really important, give me a range. And he said a few things, Seedles and this, that, and then there was something that was important, but not very important. And he said something about, rearranging the furniture on the deck of the Titanic. And I'm like, man, I am using that for the rest of my career, because you can worry about all these little things that absolutely can help, and that can help you really dial things in. But if you've got a big old gashed hole in the hull of your body, and you're taking on water because you're not fixing the main pillars, you can do all this other nitpicky stuff and really lose focus.
Yeah, I was hoping you would say Dr. Peter Attia. He's I'm a subscriber to his stuff and read his book Outlive, which is a great book. He's a little I feel like he's better suited for somebody like you to listen to, because a lot of the medical lingo that he uses. Sometimes I'm like doing ChatGPT as he's speaking, trying to figure out what he's talking about. But I love his whole concept of the what do you call it? The Centurion Decathlon. And he says he used to be a competitive cyclist. Dr. Peter Attia did. And now he's still competitive, but what he's competing for is the last 10 years of his life. And I love this whole concept of health span, where every one of us has a lifespan, and those days only God knows those days, but we have more control of is our health span. And he said, ideally, we want our health span and our lifespan to converge. And oftentimes what happens, right, is the health span is already taking a nosedive, and people are spending the last 10, 15 years of their life not enjoying life to the full. So it's in our audience here at Delay The Decay are a little bit older people, because I feel like check me on this. When you're in your 20s, you might be motivated by how you look on Instagram, or maybe to be able to run faster, jump higher, hit harder. But when those athletic days are over, you need to have a more compelling why to manage your health. And I feel like that why actually kicks in for a lot of people is in their late 30s, early 40s, where maybe they've got some extra inflammation, they've got extra weight, they're more sluggish, and they're going, I need to change something. Is that the sweet spot of your practice, is people that age group, or will it be all the way from high school football players on up to people my age?
Well, I definitely plan on tying a lot more of the lifestyle change into my athletes. I think that's a very easy but very, again, unutilized thing that a lot of athletes in this area need. That's not something that we've not unraveled that yet. That's probably going to be more as we scale. But absolutely. The other is if you're just if you're halfway doing a good job, you're probably not going to see some of those effects until like what you talked about. Especially speaking for myself, ex-athletes, because it took a long time in a back surgery at 30 for me to really, lose my toneness, and I was out of the weight room for a year. And then during that year, I had come to Waco and started my first career. And so that's when it really started hitting me. But yeah, when you start getting into that mid 30s, that's when you start seeing, that for a lot of people, it's that weight that you can't just get off just by, trying for a few weeks like you used to. I'm just gonna white knuckle and buckle down and lose that little 10, 15 pounds and, get summer ready, that type of thing. But that's also just when the body does start doing, starts doing a lot of change, and you start getting into those, late 30s, early 40s, and especially a lot of women start going through perimenopause and start changing. And I'm telling you, nothing's going to wake you up more than having hormonal changes in men and women. So you're right. Yeah, that's really where that start is, and then on.
Gotcha. When you use the language of functional health or whole person health, a lot of even beginners have maybe heard that or seen it on Instagram. What does that mean to you when you talk about your practice being functional health or whole person health? What do those terms actually mean?
Well, for me and what I do, and this is, I'm telling you, you've hit the nail on the head. This is where it is really, really hard for people because they want it to be one thing. I mean, they're willing to come and see me and pay money to hear about it and get lab work and all this kind of stuff. And you just start kind of seeing people get, you know, a little bit uneasy when we just start talking about multiple things. And the thing is I just feel like, as much as we say pillar, on anything now to teach to death, I really have to think of it like pillars. And so there's multiple main pillars, and just like a building, if you yank out one of those pillars, it may not all go down, but all of them are tied to each other, and they're going to start putting load on the other pillars. And if you lose two of them, now you're in significant trouble. And then kind of where you came at from the holistic standpoint, I think one of the biggest reinforcements between all those pillars, almost kind of like rebar, is your faith. You don't have to have a faith to get in shape and do these things, but it is a heck of a lot easier when you've got when you have that faith to lean on and to look for inspiration and to help get you through those tougher times.
Yeah, that's good. Yeah, and speaking of a compelling why, all the way back to 1 Corinthians 6:19, if you need motivation to
Right?
try to prioritize those pillars, it's stewardship. It's
Yes,
we're
sir.
temples. So good. So talk a little bit about what you hope to measure through blood work, through would it be genetics testing, whatever you do. What are you measuring that maybe the people that are visiting you aren't getting measured at their family practice doc?
Well, I really think, just a few years ago, even the hormonal part was not a big part of a lot of panels that people were getting. I think now, because a lot more health and wellness is on that forefront, and I think also because of not circumstantial, results, but again, other physicians like myself that just keep hearing, you know, circumstantial evidence that you just can't ignore, you start becoming a little bit more inquisitive and a little bit more curious about, man, how important is this stuff really? So you're starting to see more and more PCPs that are doing a great job of at least investigating the hormonal part. I think you're going to see much more coming in the future where you were talking about. I will go back to your talking about your wife really working on her diet to keep it into an anti-inflammatory diet. Huge. Never that was all an experiment with my own body of really doing strict keto for a certain amount of time, and just realizing how phenomenal I felt. No reflux, no nothing. And I'm like, how in the world can I not have reflux if I'm eating jalapeno and cheese sausage, which normally would kill me? Well, it
Yeah.
was the stuff I was eating with. It was the stuff that I was eating with that when I would go eat it. So some of the things that are probably in my panels that aren't in some, would be a lot of those where I'm looking for, inflammatory markers. Your kind of like your high quality CRPs, and your fasting insulin was is now becoming way more popular, and you're starting to see more hemoglobin A1Cs being used, because I just think that I think when we used to just do that for people that were diabetic, now you were doing it on people you thought might be pre-diabetic, and now it's just in a lot of just absolute normal panels, because we want to see if that A1C is creeping up into that upper fives, hopefully way before it ever gets into the sixes. We start talking about the words pre-diabetes. It's like, man, I'm just telling you that gap between whatever normal is and diabetes, I think that A1C number is going to start closing that gap where we're going to stop seeing these words pre-diabetes. I think that once you start kind of getting past that threshold, I think you better find a way to get it turned around pretty quick.
How can glucose monitors be helpful to your patients?
I need to get one because I'm a numbers guy.
Yeah.
Yeah, I think a lot of it is, where for me, when I really dialed in to do keto and I got a ketone monitor, and it's, the combination ketone and blood glucose monitor. It made me, and this, I'm getting to the point of what you're asking, because I think it's this same type of feedback, is you get to see what's knocking you out of keto. You get to see at least a time of when your sugars are going haywire. Your body, when you allow it to be, your body's a very, very good and solid thermostat. It'll keep things nice and steady Freddy until things start getting out of control. And it really is nice to see those. So I've been wanting to get one. My first year in residency, and I'm dating myself now. So when was that? 05, 06. They had one, and I dabbled in this. I really had the interest in it even a long time ago. But the dietitian at my residency program, she gave me one to wear, and this is one where you had to stick the needle into your abdomen, sub-Q fat, and then put all these waterproof stickers, and then the thing you would wear what was it, kind of like a watertight little bag, and it would stay in there.
Oh,
and you'd have to watch that when you bathe. Well, now they got those things you just chunk, you got
right
it.
Here.
Yeah. Oh,
Right
nice. Yeah.
So
And
I'm
they
only
do
3 days
great.
into it. Yeah. Well, there's a principle, right, that what's not measured can't be mastered. And if we live with our head in the hole on our blood panels, our inflammation, glucose, weight, body fat. You can go overboard and it can cause stress, right? Measuring our sleep is important at some level, but golly, how, speaking of blood tests, I don't think it's so much that the family practice docs don't want to measure more,
Right.
but insurance doesn't cover it.
Yep.
Even like at my age, I'm on Medicare. They measure nothing.
Right.
I think it's 14 panels, and I can go get it on my own, but I got to pay for it, and I do. But it's how do we get people? How do we encourage people to understand what's going on in their body through broader blood panels, through things like glucose monitors, maybe genetics testing someday, that type of thing? Like, what's going to actually move the needle in where it's just normal, where we're talking about this and everybody has a functional fitness doctor?
Well, it's not that you tried to set me up for a nice home run hit, but that's where I do feel kind of my next part of my passion in this project is doing social media, and starting off with the simple. Starting off with the simple stuff, but educating that, because you think that everybody knows it. Tons of people don't know it, and just the little things, and some of my great friends that I played football with, and I'll go ahead and name drop Link, because he's one of my first guys. I'm coaching him and doing some awesome things, and he's going the completely non-medical route because he didn't need to. And one of the things that he calls me, and he goes, "Man, I'm just so thankful that you told me about the bands. Mine's a Whoop band. I'm not partial to Whoop, but it's been on my arm now for over 2 years." and it's not perfect. It's just a good, and it's a good measure. Just like you said, just like the continuous blood glucose monitors, you just it's reproducible, so you can start seeing, what did I do that made my sleep so bad? What did I eat that made my sugar so bad? Why did I I got to look back at my food log to see, what did I eat that knocked me out of ketosis, and then like me, you find out that there's quite a bit more sugar in ketchup and onions than I ever thought that there would be.
Yeah.
But that's
Some of us,
learning.
it is. And some of us like to learn, and some of us like to, measure things and track things. And I'm one of those guys like you, and others don't. But you can choose your hard. You can choose your hard to measure things and look under the hood often, or you can choose your hard with just living the way that you're living, eating what you're eating, and sleeping the way you're sleeping, and have consequences later. So choose your hard. One of the things that I've enjoyed about this continuous glucose monitor in my 3 days is that it's spiked at times where it's like, whoa, what was that? And it causes me to go back 30 to 45 minutes ago. What did I eat? What did I eat? One time it spiked during a workout to like 212 or something like that. And so I was saying, well, what did I have to eat before that? And then the next day, I tried a little bit something else. I had a little bit of applesauce before I worked out, and it didn't go up as high. It just, not only is it fun to understand your body, but it is good for you.
Yeah.
Yeah.
Yeah, it's one of those things where I keep hearing this term, gamifying, and it's what it is. And I mean, I'm still from the generations of the games and video games and competition and everything, and I'm telling you, man, I'm when I'm the times when I'm doing keto, I like the countdown. I put that monitor in, I take my little blood test, and I'm like, what's it going to be? What's it going to be? And it gets you going, and getting that notification in the morning after I've been up for a few minutes, and my band tells me, how I slept and that kind of stuff. And just like you said, some people, and this has never been a thing for me, but I am very cautious about who I talk to, in my office about it, is that sometimes it can make more anxiety than we need. If people have legitimate problems sleeping, and they have for a while, and it really concerns them, and they get really worried about it, a fitness band may not be what they need. That may not, that maybe set them back. But it's just, when things are measurable, things are easier for me. It keeps me motivated.
Yeah, I appreciate you saying that. It's not one size fits all. Just even in our home, like I've got my watch on every night because I want to know exactly how I slept, so I can think about what did I do before I slept. And it stresses my wife out. She says, like, when she gets a bad sleep score, she feels like she should be tired.
Yeah.
And it's not for her. But that's okay. Let's talk a little bit about peptides.
Okay.
And GLP-1s. Will you be working with both of those? Are they the same thing?
Well, GLPs are peptides, and that couldn't have led into kind of a better topic. Doing a lot of extra training on peptides and going to conferences and learning more about them. Again, I'm being honest and vulnerable here, but as I'm sitting there I'm going through the course, and I'm like, good gosh, man, they keep coming back and talking about GLPs quite a bit, and it was weird. I went to a conference where I kind of jumped into the second half, and they said, "Oh, it's fine to do that," and I wish that I wouldn't have done that, because you're missing all the intro classes, and then but you sit there after a while and you're like, oh, they're saying that because GLPs are peptides, but they weren't ever talking about them, but they'd always come back to them. And so is insulin. And so this is a big thing that I will say, here before we start really diving into this, is that, man, it's the Wild West out there, and there's a lot of there's a lot of weird stuff going on, and people. I mean, I don't remember a few years ago people going, well, I'm gonna get my Lipitor off the website and get it from some gray site from Czechoslovakia or something like that. And so all this stuff is going on, and I just get the sense, and I'll plead with people on here, is that too many people are talking about peptides like they're vitamins, like, oh, it's okay, they're naturally occurring things, which they are, absolutely they are. But they think that they're just gonna, if they take too much, they're just gonna pee it out like vitamins, you know. And I'm like, if you don't think that they're not, they couldn't be extremely potent or potentially dangerous, you can die from taking too much insulin. You can get insanely sick and be in the ICU from taking the wrong dose or the wrong calculation of your GLP. So it's still they're still medications. They're just more naturally occurring medications, that allow our bodies to do what they're supposed to do.
And people don't always consider the known side effects either. That can be,
Correct.
psychological depression, that type of thing. It doesn't mean that it's not a reason to take it, but just like anything, you should go to a medical provider and somebody that can really prescribe it, and also tell you about the potential side effects.
Absolutely.
Yeah.
Absolutely.
So how are you going to use these in your practice? Peptides.
Well, we'll go ahead and kind of still keep that separated as far as the GLPs.
Okay.
I think GLPs. I think I'm my passion is to try to help people lose weight, feel better, get healthier. If losing weight is what they need to be healthy, to do that, preferably without medications. Now, the one thing that I don't, that we don't mess around with is if there are some significant deficiencies in hormones. This is where the labs kind of come in. Is that, first and foremost, some of the things that I'm looking at is to make sure that there are no thyroid issues and no huge hormonal discrepancies, because those are paramount. And there's some of those that you can work on absolutely naturally. Give it some trials to you know get a better diet, start working on their circadian rhythms, start doing those things, those main pillars, to see what happens. But let's say that the deficiency just doesn't correct. I'm totally fine, using hormonal medications, hormone replacement therapies, to help that, because just in my experience with this, if those things are not level, and you just try to add peptides to do different things, a lot of times you're just going to be blowing smoke in the wind, and that's a lot of money. That's a lot of money to just be throwing out there, and a lot of other chances of different things that could happen, different side effects and whatnot, because the long-term studies aren't there. We're going by a lot of circumstantial and anecdotal evidence, and we're seeing more and more good things coming out from studies and everything else. But for me, I think in my practice, the peptides are the last thing. I have people that inquire, and they want to come talk to me. They want to do some of these things, and I can get to the point sometimes where I tell that they're really focused on those peptides, and I'm just like, that's not really what I do. I don't want to be I just don't want to be a peptide prescriber.
Okay.
That's not good medicine. But sometimes, absolutely, there are people that want to try. They want to try some things that can help their body to fix things. And
Yeah.
so,
Yeah. Anytime I feel like we take a shortcut in life, it usually isn't the best route. I mean, it's to lose weight. I mean, God has designed our bodies to move, to be fueled with good proteins, fats, and carbs. And but there are those times, right, where people have done everything they can to lose that final 100 pounds, and they just can't get there. And a GLP-1 might be okay for that, huh?
Well, and yes, yes, and everybody that comes into my office, if we get to the point where we're talking about GLPs, my goal is to get them off. I
Okay.
mean, to use it and get back to normal. I mean, to fix the problems, to fix the pillars, not just put a band-aid on it. Now we're starting to see more and more, you know, anecdotal evidence and also some good studies that that are showing some of these microdosed GLPs have many other positive effects on the body. I still this is me not just whatever Central Texas MD. This I've naturally been a skeptic
Okay.
about just a lot of things, and
Okay.
sometimes I've got to see it before I really believe it.
Yeah. And
So,
microdosing would be one of those that you're still on the
well,
skeptical side.
it's just another medicine. It's I mean it's one thing where it's like I don't want to trade all these medicines that these people are on and get them healthy and then put them on another medicine where if I find out in 10 15 years that I did harm, that's just hard for me to deal with. But I really do like where we're heading with it. It's I'm the research that I've seen and that I'm seeing coming is really good. And so when something is pretty easy to give, pretty easy to deliver, and if people are not getting, like I said, if they're not, I'm not trying to like pitch that it has to go through that, but you're just taking your life and your body into your own hands when you're doing some of that stuff that doesn't come from good sources.
Yeah. Well, I appreciate your even humility again there, that you're just because you're learning about functional health, like you're you're not drinking all the Kool-Aid and passing it out. You're examining it and you're open to it, sounds like, but you're skeptical. And by the way, I want a doctor who is skeptical, not closed off from. Otherwise,
Right.
a closed off doctor would never do what you're doing.
Right.
But when we're skeptical, it has us explore what else might be out there.
Sure.
What compounding pharmacies do you are you familiar with that term? A
Yes,
compounding
sir.
pharmacy. Thoughts on that? Do you use those? Stay away from those? Are they a
No,
gift?
I do. There has to be, proper FDA oversight. Everything. That's another thing about me is I'm, ever since I was a little kid, maybe that makes it where I'm not a huge adventurer, but I'm pretty much a rule follower.
Okay.
And so yeah, no, there's great compounding pharmacies out there that help. And it's all, I mean, the stuff you have to do to be a part, to be linked up with those. They have all of my licensing information to a T, and they do it by the book. There's just people out there that are going to do it by the book and people that are not going to do it by the book. And the people
Yeah.
that don't do it by the book typically make a whole lot more money,
Yeah,
but
I know.
but you're asking for it. You know what I mean?
Yeah.
There's just a time where someone's going to come down on you, and you better hope that you've stashed that away.
Yeah. So if somebody comes into your office, they've done the blood panel, and it shows that this is Dan Hardy terms, not medical terms. Their hormones are all messed up. They're low on testosterone, could be estrogen, whatever. Are are you going to prescribe better sleep, better nutrition, exercise before HRT or testosterone, or along the way at the same time?
Most of the time depends on the patient.
Okay.
I'm going to do my best to talk them into doing natural first because natural to me is always better. There are people that are going to have systems that are off. I mean, that are just going to be off and stay off or be broken. Those are the ones that you can kind of tell on some of those where there is a problem, and that needs to be addressed. But if people tell me the story and I feel like they really have gone through things, and then even sometimes we'll get their spouse involved, as long as they're okay with it, then sometimes you get a little bit of a different story. But sometimes you get corroboration, and then you're able to feel better about starting them on something initially. So it just depends. It is all patient dependent.
Gotcha. And the tablets that people are getting in their lower back, is that usually testosterone?
It can be testosterone and or estrogen.
Okay.
Most of the time, progestin is going to be an oral. So most of the time, people are fine taking oral medications as long as they don't have to inject it.
Okay.
And then there's tons of people that prefer injecting their hormones because they know what they're getting and when. But like you're saying, the pellets are just more
Pellets, yeah.
set it and forget it. You know what I mean?
Yeah.
And there's a lot of people that like that too.
I've never done that. I know it. The world I live in. There's a ton of people I know that do that, and they love it. I'm afraid with stuff like that I'll never get off of it. Is that a problem?
I think when you get to that point, and again, that's why I'm glad I do have some of my patients and friends that are like, hey, I want to try to do it natural. I wish that I would have known more about this. Again, I'll be a little bit vulnerable here. And this will tell you, this will be a little shocking also. So I got, my daughter is 12, and I got on testosterone, right before we conceived. No, right after we conceived. And, but that's what I went for. And I went to my PCP, who's still my PCP, and we had some discussions about it. And I don't think either one of us knew enough about it 13 years ago to understand that when you go on TRT, you're sterile. It makes you sterile. And I didn't know that. And by the grace of God, we were blessed to have our Ella Grace before I started. 'Cause I went thinking I needed to be on testosterone to be able to conceive.
Wow.
And so it just goes to show you that even just 13 years ago, there were two guys out there that you would think we should know that more. And it was very innocent. It was a very innocent mistake on both of our parts to think that would have helped. So I've been on it. I've been on it since. I love it. I think it's great. I've had no side effects or issues from it personally. But I was concerned about all that. But I've been blessed to have good people watching me through all of it and doing the appropriate testing and all that good stuff. So
You don't have hair growing on your tongue or your forehead or anything like yours?
I had some hair on my back pop up for the first time, which was a little bit interesting.
Yeah.
Yes, sir.
That's great. And your
Who
wife's
knows if that would have who knows if that would have happened anyways in my late 30s, early 40s?
sure.
But yeah.
But your wife's going, do I want Corbett on testosterone with a hairy back or no testosterone?
That's right. That's right.
That's
That's one of the things where, like I was saying, if I would have known, if I'd have been more educated into those basics, those pillars of health and wellness, 110%, I would have tried that first. 100%. As I even talked to some people after I went to some of the peptide courses about, well, can I get off of it now and maybe see if everything wakes up, and they're like, well, yeah, it's been over a decade. You'd have to take, some of these medications, take some of these medications to do this, that, and the other. And I'm just like, I think I'm probably good. Testosterone's been tried and tested, and it's, I feel very, very comfortable with it. And I've been on the same small dose for 13 years, and I've not had to ramp it up. You know what I'm saying? Like you worry about is my body getting used to it. So.
And your blood markers are for testosterone have stayed
Yeah.
pretty consistent over those 13 years? Yeah.
Yes, sir.
Yeah. Hey, I've got two other questions that I want to maybe wind us down with. One is just cholesterol. The the medical community has had a particular view of cholesterol for decades, and now there are some in the functional medicine space that are going overreaction. It's not that big a deal. In fact, higher cholesterol in some cases is okay. Where do you land? Do you have opinions on
Whew.
that?
I do. I think that there is a very happy medium somewhere in there, and that is not a sellout, answer. Is I really believe that. I'm far more concerned when I'm looking at people's lab work. I'm far more concerned about a significantly elevated triglyceride level and low HDL than I am a moderately elevated LDL. I think that's where you're starting to see the biggest contention, in the traditional medicine, health and wellness, mix. A lot of production, and here we go. So I mean, how crazy if a good medical fad has it been to tank your LDL? I mean, it's been going on now for decades. I mean, all of the statins and just low fat this, low fat that. Well, I mean, is that a cause for some of the reasons why we're having so many hormonal issues? I'm just speculating because I mean that's what a lot of our hormones are made out of, is a cholesterol base, and a lot of the stuff that is involved in our brains has to do with cholesterol as well. So it's I don't know. I honestly don't even think it's really that much of a sensitive subject anymore. It's just, I think a lot of physicians that still believe that you need to get your LDL level low, I think they're starting to look into this more. I mean, I think you're going to see, I think we need to have some really widespread updated studies on that, because you're starting to get people that have had elevated cholesterol for years, but their triglycerides have been down, their HDL levels are high, and now that we've got all these calcium scores and stuff that we can do of the chest and everything, and you're seeing people come back with scores of 0 that have got not fairly significantly elevated LDL for years. But I don't know. That's kind of where I sit right now.
Yeah, my wife has higher cholesterol. It's not off the roof, but pretty much every time she goes to her PCP, they want to send her home with a statin, and we've been able to manage it, actually bring it down through diet and through exercise. And I know that's not the case for everybody, right? It's never one
Sure.
size fits all, right? But it's like, as a non-medical professional, a guy that cares about people living healthy lives. So I feel like there's a principle that before we throw medication at something, medication's a gift. Let's first acknowledge that. But before we throw that good gift at, let's see if there are some ways through diet and through exercise and better sleep, and less stress, and see what happens. And if it's still elevated, right, let's explore
That's
those
right.
other options. Yeah.
Well, and see like you were saying, what your other, and what are the other risk factors that you have in your life from even from disease standpoints or chronic disease standpoints that cause you to, that combined with an elevated, cholesterol could lead to something,
That's good.
bad. Yeah.
Yeah. So where I live in northern Colorado, it's I would call it a middle class to upper middle class area. In all of our surrounding towns, we've got clinics like yours. We've got Sprouts, we've got Whole Foods, you've got Trader Joe's, you got healthy places. Still got a few dollar stores in there. But I have a real passion and compassion for those that aren't educated. Thank you for heading in that direction. I think it is massively important. The Peter Attias of the world are great, but the common people listening to podcasts aren't going to turn into a Peter Attia. So they need to be educated, and also they don't have the resources. I mean, living a healthy lifestyle is not cheap, and insurance doesn't cover most of the things that we're talking about. Put on your whatever hat that is, how are we going to get there in a country where it's not just the upper 20% that can engage with this stuff, but where we can actually help the bottom 20% of wealth I'm talking about?
Sure.
Yeah.
Well, I mean that's where I was telling you, the I guess mine's free. I mean phones aren't free, but everybody's got phones. Everybody in the bottom 20%'s got iPhones too. So but I mean stuff like we were talking about, like social media, YouTube. I mean you got to put a product out that people want to watch, but being able to hopefully be able to use, even just to use my credentials as an MD for people to go, well, maybe I might want to listen to him. But if I can start with those basics, and I mean, my goodness, make it as interesting to them as it was to me. I mean, it's just one of those things, but you have to have interest in it too. I think what you can also find out, and this is what I would tell anybody, and I tell everybody that comes in my office, if you can get, what are they calling it now? Single ingredient foods, whatever that really means. But I mean, a lot of natural, if you can get to the natural foods, now there's still a lot of those now that are a lot more affordable, but that may mean you've got to go to the store 2 times a week. There's all sorts of things that are going to be the sticking points. Lower socioeconomical folks may have problems even just getting to the store, or the food islands where there's just not stuff around them. I would love to be able to get to a point where if they can find a way to get there, I can help what needs to go in their grocery cart, and within at least start off from a dietary standpoint, but also teaching their kids, when to be on and off their screens, when to get to sleep. You know what I mean? I think we're going to be able to help. I really think we're going to be able to help that part of our country and the world if they're interested.
Yeah, that's good. I was talking to a buddy yesterday about the SNAP program. I'm not sure what SNAP stands for, but it's money that people get under a certain income threshold to buy groceries. And the way SNAP's set up right now, if they want, they could spend the entire $60 on Coca-Cola. And so maybe even having some restrictions on free money that's coming from the government that can be spent on things on the outside of the store, not down the aisles, right? And healthier school lunches, that type of thing. It's all that can be helpful, I feel like.
Oh, I totally agree with you. But I think it's it's one of the wonderful things about living in the United States is that you have choice on a lot of things, and unfortunately, there's a lot of folks that just aren't choosing the right thing. But I agree with you. It's one of those things where I have sat in the grocery store multiple times and seen some of the carts come in that are using those programs. It blows me away what they're able to buy.
Yeah.
And what they do buy and don't buy. And I hope I really hope I can help with that in some way.
There's no doubt you will. Yeah. I'm excited for the season ahead for you, Corbett. I mean, there's no doubt that you're going to impact the lives of so many people. And you've always done that, but in a different way now. And it's really inspiring that you're not making a complete pivot. You're continuing down the orthopedic route, but then you are also adding this to your plate. So I do want to encourage you to continue to drink the Kool-Aid, take your own prescriptions that you're giving your clients at age 48, or you're approaching 50. Man, like we are in perpetual decay and atrophy, and we've got to stay ahead of it by continuing to live the way that you're telling your clients. So I have no doubt you will. So if you want just one last closing comment, how would you want to encourage the people that are listening? These are ambitious builders and creators. They're people that are just going for it in life, but maybe they're not paying attention to their health in a holistic way. How would you encourage them?
Well, if I could interject just before that and just say, how much I love and how important all of our PCPs are. They start getting, physicians do get a bad rap about how we don't know about this stuff. We know what we're taught, and we're taught to be solution makers when there are problems and that there are issues going on in the body. So I want to say, first and foremost, keep doing what you're doing, because oh my
Yes.
gosh, we need it. We absolutely need it.
Thank you.
I hope I can help by just getting on the front end to where maybe some of my friends, some of my buddies here in Waco, they'll get a few of their patients that are maybe a little bit healthier, that maybe just come and see them when they have something that they need help with.
Yes.
But to answer your question, just be curious. I mean, here's the one thing that makes me probably one of the most sad about where we are now, is that now we have so many people that are living in chronic disease states that are possibly fully reversible or even partially reversible, but definitely a lot of them are preventable before it ever started. And we're losing it. I mean, I can remember my generation. Like I said, I'm 48. I remember the 80s very, very well, and there weren't just a ton of heavy people. I mean, there were some heavy families, but we have no idea what how they grew up eating and whatnot. But I mean, all of us were like this. I mean, we were little rails, and we're losing I don't even know when we lost that, where a generation would remember that. So we now have generations who have only known husky kids, that have known, adults with some level of metabolic dysfunction, and we've got to turn that around. I mean, we're seeing the fallout of that, as we speak. So, be curious. Don't think because you have some, chronic issue that your life and your health can't be better. You owe it to yourself, and you owe it to your creator, to seek more, to ask more questions.
That's a great word. If people want to follow you, let's say they live down in Central Texas and they want to find you, how do they find you?
619 healthandwellness.com is my website, and I am on, I think, Facebook under the same. I've got my personal Facebook as well, and then Instagram. I'm
Great.
sure we'll be branching out into the other ones, but it's just got to have a little bit more time.
Yeah, that's great. Well, I'm personally looking forward to following your journey and seeing how God uses this passion you have to continue to just help people live more healthy. So thanks for being a guest with us today on Delay The Decay. And I want you to remember, a Delay The Decay audience, this 1 Corinthians 6:19. It says that our body is a temple of the Holy Spirit, and you are not your own. Everything that we have, our relationships, our body, our mind, and our finances, that God trusts you for you to steward it. So I want to encourage you to make hard decisions to steward what God has given you. And it'll bring him honor, praise, and glory. It'll bring you more joy, and it also will bring more good and flourishing to the relationships that you have. So until next time, remember, it's about direction, not perfection. See you on the other side.